Hi everyone. In this micro-learning lecture from Medical Family Mandalay, I would like to introduce about a very basic, very common physical science which we have learned since third year medical student. Yes, as you see, you may know what is this. Yes, it's about clubbing. So let's start. What's clubbing? Clubbing is the painless swelling of the soft tissues of the terminal phalanges, causing increased longitudinal and lateral convexity of the nail. Everyone, most of the students know about causes of clubbing, but we don't really emphasize on and we don't really know about what is causing clubbing. Why does this occur and what is the pathophysiology of clubbing? Yeah, it is there are three main mechanisms which cause clubbing: platelet-related, hypoxia-related, and hormone-related. Platelet-related. Yeah. It is seen in cases of chronic inflammation. In chronic inflammation, there is release of a factor, what we call is platelet-derived growth factor, PDGF. It causes the proliferation of the fibroblasts, which in turn causes increased production or increased proliferation of fibrous tissue and proliferation of subcutaneous tissue in our nail beds. So, resulting in clubbing. So, any causes that lead to chronic inflammation could result in this pathophysiology. So, for example, in GI causes like ulcerative colitis, Crohn's disease, celiac disease, and in lung diseases like chronic infection, inflammation like bronchiectasis, lung abscess, empyema, and some of the tumor like lung cancer and fibrosis of the lung could result in this pathophysiology. Okay, another one, it is hypoxia related. In our body, oxygen is carried by the RBC. In cases of hypoxia, to increase blood supply, our body reacts with the vasodilation. So vasodilation leads to the increased blood supply to extremities. This increased blood supply results in proliferation of the fibrous tissue and subcutaneous tissue in nail bed. So this also results in clubbing. The best example of hypoxia-related clubbing is cyanotic congenital heart disease, and in some cases of AV fistula. This is how hypoxia-related pathophysiology causes clubbing. Okay, another one, it is hormone-related. So what is the hormone related to growth? And basically it's growth hormone. But increased growth hormone causes acromegaly, you already know. In acromegaly, the swelling or the proliferation of the muscle and subcutaneous tissue is generalized. So we didn't put it in the causes of clubbing. But in case of estrogen, as we all know, causes vasodilation. So it also causes the pathophysiology similar to this. And so excess estrogen causes clubbing. The best example is cirrhosis of liver, where liver cannot metabolize estrogen since it is failed. Okay, another one is another hormone-related cause of clubbing, as we all know, is Graves' disease, And like other thyrotoxicosis, Graves' disease causes clubbing. Why? Because Graves' disease secrete is related to TSH receptor autoantibody. It causes the proliferation of fibroblasts. This antibody cause proliferation of fibroblasts which secrete hydrophilic glycosaminoglycan. This results in interstitial edema and fibrous proliferation of our nail bed resulting in clapping. And the same pathophysiology applies to Graves' ophthalmopathy and preterm edema. So, unlike other thyrotoxicosis, Graves' disease results in clapping. Okay. So, is the division bounds of clapping, and you can read it later in your textbook. Now, I would like to emphasize on two important physical signs which can be seen in clapping. The first one is Lovibond profile sign, and the angle between the finger and the nail is what we call is the Lovibond angle. It is normally around 160 degrees, and in cases of clapping, due to the convexity of the nail, the angle became lost and it became more than 180 degrees, what is called Lovibond profile sign positive in clap finger. Another one is Shamrod sign. In normal individual, there is a distant aperture or window. Usually diamond shape is formed at the base of the nail beds, but in the clap finger, because of this clap appearance, the diamond shaped window loss, what we call is Shamrod sign. You should know that it is Shamrod window test. So, stages of clapping, and it's a normal nail. In this, there is no clapping shape, but there is loss. Nail 4 is lost, and fluctuation test is positive at the nail bed. Another one is the convexity, increased convexity of the nail, and in grade 3, there is an increased pulp diameter. It is the clapping is very distinct, and grade 4 is the drumstick appearance of the nail, very gross clapping. Okay, and it's the end of my short lecture on clapping. Goodbye.